Okay, just to continue on the last few items, make sure that you're very familiar with the Fulmer Spices Framework. Know the components of that. Um, Commit those to memory because you may see reference to that on test questions. Um, I think I did say before the end of the last one to really focus in on medication effects that adverse medication effects that are very common in the elderly, which those are listed in your slides. Um, Key reasons for weight loss in the elderly. Um, Obviously, they have some fluctuation sometimes with, um, you know, with congestive heart failure. We know that already with, you know, diuresis and that kind of thing. But more commonly, sometimes eating is not taking place, like we said, because of finances, because of can't chew their food properly, and therefore they eat foods that are just like very soft in nature and kind of run through their system and don't get as much calories as they need or the amount of protein that they need, which are two key things you want for the elderly: high protein and high um, calorie, if at all possible, to maintain a healthy weight. Um, Look and go through your list of what pre-op activities would be typical for a FemPop bypass surgery. Um, Again, typical post-op interventions to prevent DVT. Y'all all gave great examples about that, and that was on another section as well, just in general preventing DVT. Um, Obviously, getting somebody mobile is one of the key things that we talked about, along with other use of things that kind of support that. Um, Know some of the standards within a typical heparin protocol. Some of those include the things that you would not have somebody on. Obviously, you're going to, if they're on any kind of antiplatelet, anticoagulation meds, those are going to be held while you're on heparin protocols. But use that protocol I gave you as a guide for those type of standards. Um, know that most of them are going to be based on weight. So, you want to get an accurate weight on your patient before you even begin. Um, Elements required in discharge instructions regarding Coumadin therapy. Some of those examples are on that last page that you had in your heparin protocol packet. Kind of down towards the bottom of the page, list the specifics that they're looking for that people are educated on. And just don't memorize those lines, but make yourself some notes as to how would you go about, what kinds of tools would you use, or what all would you discuss with them if you were going over those different items that are listed. Um, Risk factors associated with aneurysm formation. Those are listed in your slides, but of course, typical things that are common for atherosclerosis in general, of course, are that. Um, and then appropriate actions with patients. Just typically kind of like what would you normally do when somebody presents with aneurysm symptoms. Obviously, that is a huge emergency, like I mentioned, and is on your slides for that. You might want to review that in your book in kind of great detail. And then last question, like I said, you're going to be expected to calculate enoxaparin dose based on the typical milligrams per kilogram and max dosing that was in your last question on your protocol sheet. So memorize the typical milligram per kilogram and what the max dosing is so that you're able to answer a calculation question. And that will be for a bonus point for 4 extra points as well. In terms of medications, a few people have asked me a little bit about that in emails and in person. The big thing is no, all these are just different meds that are listed in questions on the test. Obviously, you've seen a couple examples of the warfarin things that they're wanting you to really know. How is that monitored? What kind of labs and things are drawn afterwards? What kind of teaching do you do related to food, related to that? Um, and then enoxaparin, of course, is a focus for DVT prevention, as well as how to do your calculation question. The place or activase question has to do with the one that where it talked about mental status changes. And then these other drugs are kind of really drugs that would be given for pain or sleep or just different treatment in the elderly. So make sure that for all of those ones that are listed, Benadryl, Dilaudid, Demerol, Flexeril, and Toradol, that you look at those from the standpoint of how would which one of these would affect elderly? Are they on the Beers list of drugs that should not be used or not? Those would be your key things. And is there any particular monitoring or dosage changes that you might want to see for any of those? And I think that about does it.